Osher, the Osher Lifelong Learning Institute at Berkshire Community College. And as the magic lady just said, this class is being recorded like all OLLI courses that are held on Zoom. So if you miss a class or you want to watch one again, all you need to do is request a link to the recording from the OLLI office. It's usually ready a couple of hours after the class, and we'll be happy to send that to you. And you can send that to OLLI, O-L-L-I, at berkshirecc.edu. And I also want to remind you, we have a new classical music series starting out this Sunday at 1 p.m. and I put the information in the chat function. And I also want to say a very special hello to Eleanor Aronoff. I believe this is the first Zoom class she has gotten on, and we are thrilled for her. She is, I think, 94 years young and a formidable and fabulous person who has been a longtime OLLI member. So yay, Ellie. So glad to have you here. Woohoo! So it is my great pleasure to introduce Erika Allison. She is going to be the moderator and conversationalist with our guest today. She is the chair or the president of the board for Nonprofit Center of the Berkshires, which Liana who was here last week, is the founder and director of. Erika is Assistant Vice President and Financial Advisor at Willow Investments for Loving Change, a Berkshire-based women-led wealth management firm focused on socially and environmentally responsible investing and shareholder activism. Erika helps her clients do good while also doing well and leave a legacy that supports their values as well as their family. Her past experiences as an engineer, and I did not know that, an engineer, with Fortune 100 companies and as a leader in the nonprofit sector, led her to the conclusions that capital can be a powerful and influential tool for positive change in the world. In addition to serving as president of the board for the Nonprofit Center for the Berkshires, Erika is on the board of WBCRLP, the Berkshire Community Radio Alliance, and is also an ordained interfaith minister. So she is a human, what do you call it? Oh gosh, I forgot what it's called, but the knife with all the different parts. What is that called? The Red Cross knife. Golly, I can't remember what sorry.
I don't know, but I want to learn what this term is.
Swiss
Army knife.
Swiss Army knife. Okay, yes.
I have 2020 brain. You are a magnificent Swiss Army knife. She works towards innovative, conscious, and inclusive economic development in the Berkshires and beyond. So, Erika, thank you so much for being here, and welcome.
Thank you so much for that introduction. And yes, I'm excited to be here. Liana gets to have all the fun by doing these calls. And when I heard that there was an interview to be had with these two amazing women I'm sharing the screen with, I kind of bumped my way in and said, let me do this interview. So here we are. Our plan for today, I believe if you have joined in previous calls, you know how this goes. But I'm going to introduce our two guests for today. And the topic is really focusing in on these two nonprofits, these two amazing nonprofits in the Berkshires, hearing a bit about what's going on for them, especially in light of our current times, and ways to get involved. So those are really the goals for today. Before we introduce our two guests, I just want to put a little bit of context around the nonprofit sector here in the Berkshires so that we can start high level and then we can zoom into these two examples of amazing nonprofits. So just so everyone knows, if you haven't heard, there are over 1,000 nonprofits in the Berkshires. We actually have one of the highest rates of nonprofits per capita anywhere in the country. So it's a thriving sector for us. And actually 1 in every 4 jobs is a nonprofit job. So it's also a massive economic driver in the Berkshires too, just by how many people we employ. And the last thing I'll tell you, I'm just reading some notes over here, that we have a bunch of small nonprofits. So 75% of the nonprofits have annual revenue under $250,000. So just so you get a landscape of what's going on in the Berkshires. And there's one more statistic I have to point out because it's related to people here who might be thinking about donating and volunteering their time. The value of 1 hour of volunteers' time in Massachusetts, it rose 3% last year, and it's up to $32 per hour, which makes it the highest in all 50 states. So just so you know, if you're listening, you are valuable. And I'm sure we'll hear more from these two nonprofit leaders about how you can get involved and help with that valuable time and skill that you have to give. So with that being said, we encourage questions. If you know how to use the chat feature, if you hover over the bottom of your Zoom, you'll see a little bubble that says chat. If you click on that, you can have the chat window up on your screen and you can type in questions. If you're having any issues at all, you can type that in as well. And our tech support Maven Ray will help you. So feel free to jump in that way. And you can also raise your hand. And if I see that, I can call on you. But I want to give our two guests a little time to talk before we open it up for Q&A, but that's kind of how we'll flow. So let's see. I believe that Leah was going to go first. Is that correct? Is that how I understood?
So, and I was just trying to put CHP's website in the chat box.
Okay, great. We'll give you a second to do that. And in the meantime, so I'm going to be asking each of our guests to introduce themselves. You're looking at the two leaders of these two amazing organizations, the Green Center and CHP, Community Health Programs. So I'm going to ask them to introduce themselves and to kick off by telling us a little bit about their nonprofits and what is the mission, what are the programs, what's the role that each of these nonprofits play in the landscape of the Berkshires. So Leah, would you like to kick us off by just telling us about
I'm happy to do it. I'm Leah Spiliotes. I'm the CEO of Community Health Programs, and I came to the Berkshires about not quite, but getting close to 5 years ago as the interim CEO for the organization. And after about a year of being here and working with this amazing institution, decided to throw my hat in the ring for the permanent CEO position. And I was blessed with having gotten the job. So it's really been an incredible journey. I've enjoyed it a lot. We've done many things. I think for those of you that knew the organization about 5 years ago, we were basically half our size. We're comprised of a series of practices across Berkshire County, from down here in Great Barrington where I sit, all the way up to North Adams. And they include health, dental, behavioral health, physical therapy, ophthalmology, pediatrics, women's health, among a few, and nutrition. I'm probably leaving something out there, but we doubled our size. So we went from 5 locations to 10 locations. We went from about 11 to $12 million. We're now a $25 million organization. So we're, in fact, are one of the larger nonprofits. We went from about 165 employees to 240 employees. Just tremendous growth, and tremendous growth driven off of the important need to keep practices in business. It's not easy to be in private practice, and we are a large organization that looks at those private practices and really values the importance of keeping health access open. So we bring those practices under the CHP organization, and that's how we've largely expanded. The other thing that I'd like to mention is that we have two mobile health units, and I'll tell you a little later when I talk about COVID how that really played out in their utilization. And many of you know of our family services business, which is parents and child services, women, infant and children, SNAP, deal with food instability and housing insecurity, and a lot of services that we bring to individuals and their families to keep them safe and able to live their lives. So that's basically it about the organization. My hope is that looking out into the future, there'll be other opportunities for us to bring more people under the fold. We now have 35,000 patients and clients from family services through all the different health sectors that I talked to you about. I think I'll talk a little bit about COVID, that might be helpful.
Can I pause you before you talk about COVID? I want to just kind of lay the landscape of both organizations first, and then I do want to get into the specifics.
Okay, sure, gotcha. Gotcha.
Awesome. Okay, so let's switch gears. We're going to go from we're going to go over to the mental health side of things now. So Chris is going to speak to us a little bit about the Breen Center. So go ahead and introduce yourself and your organization.
Sure. Hi, everyone. I'm Chris Macbeth, and thank you for having both Leah and I today as part of your group and your conversation and discussion. This format, I know it's relatively new to all of us, and sometimes can be difficult to kind of promote ongoing conversation and discussion, but I hope that we're able to do that. But let me start by telling you a little bit about the Breen Center. The Breen Center is the region's largest provider of mental health and addiction services. We employ over 475 people at 26 locations throughout Berkshire County. And on a typical day, our clinicians and our other staff provide services to over 1,000 people. Even during COVID, that is happening. And we'll talk about that and how we're doing things differently. I think just to share with you a little bit about the agency's mission. Of course, we have a mission statement. How I sum it up is kind of in one sentence, that the Breen Center believes that everybody in the community benefits when everybody is emotionally healthy. And our primary responsibility to the community is to help those that are living with mental illness and addiction and helping them to get healthy. So just to share with you a few vignettes, I mean, our agency is incredibly complex. And I share that because when I first started here, and I've been here about 10 years now, not in my current role, but I've been here about 10 years, I did not fully understand the complexities of the organization, but just to give you a sense, I'll give you some vignettes, real quick ones about the typical person that we might serve in the community. For example, a mother might call about her 13-year-old son, and she's not sure that he needs help, but she thinks that he does because he really seems very sad and overwhelmed. And she doesn't know if it's normal or not normal, and she needs some help. She comes to the Breen Center. Then we might have another woman that said that she needs some help because she's sad, feeling very alone, very depressed, and cutting herself. She might be a referral to the Breen Center. She might come to the Breen Center on her own. We may have a 72-year-old gentleman who lost his wife last year and is talking about taking his own life. That's somebody that might come to the Breen Center. We have a 25-year-old pregnant mom, and she's using heroin. And if she gets admitted to the hospital, she's afraid because she's going to lose her job. So she comes to the Breen Center. What can we do for her? How can we help her? Or you have a grandmother that is calling about her 6-year-old granddaughter who's now living with her because mom is an addict, if you will, and the child has started wetting the bed and she's having a really difficult time engaging the child. That person might very well make their way to the Breen Center. So that's just a few of the vignettes. I could go on and on about that, but I think it gives you a sense of kind of who we are. Last year, the Breen Center provided care and treatment and services to over 10,000 people in Berkshire County. And 4,000 of those folks that we served were children and adolescents. You know, and I think what's most important, it's really the people that are coming to the Breen Center. It's their courage and their care, their courage that really allows us to provide them with the support and the help that they need to really reclaim their lives. Because these are folks, these are your neighbors, these are your friends. These could be your family members that are living with a mental illness or addiction, and they just need some help and support so that they continue to be an active and productive member of the community. That's the typical person that we're going to serve.
Wonderful. Thank you for laying that landscape. And as we can tell, we're really working with two massive infrastructure pieces of this economy, which is a perfect segue into our next question. When a community experiences an out of the blue event like a pandemic, how do our infrastructure players like CHP and the Breen Center, what role do you take on in those situations? So Leah, will you kick us off and tell us a little bit about how COVID has impacted your business, your organization, and some of the response efforts your organization has made?
Sure. I mean, in a heartbeat, COVID shut us down. And literally one day you can see patients in the office, and the next day you can't see patients in the office. And we, like Chris, we did 115,000 patient visits last year. So it's a massive operation. So one of the things, though, that worked really well, and Chris and I had talked about this, the quote silver lining, was telehealth. And literally within a matter of days, we had people up and running, all of our providers up and running on Zoom, the telephone. We brought people into the parking lot, into tents. We had curbside, which we continue to do, where you drive up in your car and somebody comes out to your car and does, gives you an injection, takes your blood, does whatever. And then we also started doing, again, checking for safety, in-home visits for people who we felt needed to have somebody live touch them. So that was really an amazing pivot. And fortunately for us, from an economic standpoint, and it still is the case, but for how much longer, I don't know, the alternative technologies are being reimbursed at a rate the same as what you get reimbursed when you see somebody in the office. So while our revenues dropped to 30% of what we were initially making, they came back up to operating at about 70 or 75% through the adequate reimbursement for alternative technologies, which is great. So we surveyed our providers, and God, there are some people who just love telehealth and literally have said, as we've begun reopening the different locations, I'd really like to stay doing telehealth if I can. It's what I want to do. And others who really were less comfortable with telehealth are excited that patients are coming back in the office. So that was really the overarching kind of strategy that we had. We did, and I mentioned earlier, the 2 mobile health units. We did roll those out. We took one to Berkshire Pediatrics, which is our pediatric practice in Pittsfield, so that we could do well child visits on the bus, as we call it. And then the other van went around to try to bring healthcare to different parts of the region, and also to deliver food, basically. We have, that's another component, family services that I told you of, literally went from giving out 50 bags of food a day to 350 bags of food a day, and it continues to maintain the same as it has. There's just not, we don't see it as something that's gonna stop. So we continue to have that need to do that, and we continue to use the vans every day out on the road, seeing patients and taking care of things. The somewhat of the challenges is, and I think others have experienced this, is that it's not necessarily true that people were just dying to get back into the center. That they, and as the numbers have steadily risen, although good to hear in Massachusetts, I was talking to Smitty Pignatelli the other day, and he told me that he went out to dinner and he didn't recognize anybody where he was out to dinner, and all the plates were from out of town. So that gives people a lot of pause of concern that the rates can increase, and that would be something that would make them feel uncomfortable. So not wanting to leave their house, not wanting to come to a place where maybe they will see, they'll be in the midst of other people who could be. So that is a challenge. It's a challenge for us to definitely have people understand the letter of the law, safety precautions that we take in the actual geography of our locations, and internally what we do, and then the steps that the staff make to ensure that it is safe for not only for patients but also safe for our staff. And I think we'll continue, as I said before, to need resources for making sure donations, making sure that we can provide the food and other items necessary to keep families operating. So.
And that's an interesting trend that seems to be coming up, that nonprofits are operating a little bit out, their scope is getting a little bit bigger as they look at the whole need of a person. And I'm sure, Chris, you'll have something to say about this as well. But it seems like the Berkshires has been pretty amazing at stepping up and offering beyond maybe what is your typical services in this time. So Chris, let's transfer to you and let's hear, how is the Breen Center, how is COVID and the Breen Center interacting with each other?
Well, just to follow up on your comment, is at the very, very beginning, the coronavirus kind of temporarily put us in crisis mode. And like, what are we going to do? We see people, our work is face to face. That's how we historically helped people and supported people, is face to face contact. So coupled with the fact that we typically serve a very vulnerable population, So it's, what are we going to do to help these folks and support these folks and make sure that they stay on track with their recoveries? And we also recognized, given everybody's stress, anxieties about the unknown, that likely the need for our services was going to increase. And we in fact did see that. So we immediately, as Leah talked about, we immediately transformed from a face-to-face business to predominantly early on, I probably had about 60% of my staff working from home, and about 40% were still in different settings throughout the agency. We very, very quickly, with the support of Berkshire United Way and the Taconic Foundation and the Boston Foundation, we were very quickly able to buy, I can't tell you how many laptops we bought, I can't tell you how many cell phones we bought in order to support our folks doing telehealth from home. So I am, as we have gone through this, I think the other silver lining for me personally, I've always been amazed by our staff, and they are just incredible. They moved so quickly and adjusted, and we're gonna make this work. Everybody got on board right away, which to me is just, it's very, it was very exciting to see. I'm always looking for the positives that come out of things, come out of the crisis. So we were doing that piece, but then now we serve in our residential programs, we have residential programs for those that are in early recovery for addiction. We have residential programs for those adults that are living with pretty persistent mental illness. And then we have residential programs that provide short-term crisis stabilization as well too. And it's like, what are we gonna do with that? With that, we, and again, my staff were absolutely amazing. We went after all sorts of PPE, whether it was through the state resources, local resources, or just, one example is we went to Zogix, okay, here in Lenox, which typically supports gyms with their cleaning equipment and everything like that. We contacted them for cleaning equipment, for cleanings, for everything. We did anything and everything we could to get the kind of PPE that we needed to support our staff so that they could still work with the folks that we serve. So we made that happen. And at the same time, we had my crisis team. Part of the Breen Center is, some of you have probably heard of the crisis team. So for those that are, have a behavioral health crisis, we provide service 24/7, 365 days a year. So we were still providing that service in the community, face-to-face, in the emergency room, and we did a lot by telehealth as well too. And then we had folks, because of their prescriptive treatment plan around and their medication needs, were still coming in for medication. So, and then we had folks that continued to do outreach. So we had a combination of, to be honest with you. But to kind of come full circle with that, just to give you an example, during the month of April 2020, we had 20% more client contacts than we did in April 2019, which, in what we're dealing with, and I'm sure Leah is as well too, is people that are really living with anxiety and fear and the whole idea of being so isolated. So, it's kind of revealed the inner strength of everybody. I think the pandemic has, our staff as well as those that we serve. And for us, the silver lining too is telehealth. Telehealth is now, we moved so quickly to meet the state requirements around policy and protocol and getting things set up so that we could get reimbursed, as Leah referenced, so that we could get paid for that kind of service. So we've concluded that telehealth is very much going to be part of our future, because the reality of it is, it works for some folks. Still want to be seen in person, but there are folks for whom telehealth has been highly effective. We have a bit of a captured audience, and our no-show rate has decreased. So that was our experience with it as well too. So that's clearly our silver lining. And I know I'm repeating myself, but I will say it one more time. I think, again, the silver lining for me was to see how quickly we coalesced as a very large staff and made it work, so that we were sure that the folks that needed our services were getting our services. So it's just, again, another comment on an amazing group of employees that I have.
It's truly remarkable what each of you have done to be able to continue serving in such a crisis, in such a time of need, and how you've responded. There's a question from the audience that I think fits into this place in our conversation, and it is about telehealth, since you both mentioned telehealth. I've heard a statistic that we accelerated 12 years of time when it comes to tech adoption rates. We fast forwarded 12 years on the tech adoption scale in the matter of these 3 months that we've been in this way. And I think this is a perfect example. I mean, how many people on this call are now very proficient with Zoom, whereas it might have been something they never tried before. So the question that came in from Bob is, what other tech applications do you see being applied and or emerging aside from telehealth? And I'm going to say, and along with telehealth, like, is there more you'd like to say about that will help our community into the future?
I think there are a variety of things. And I too was amazed at the speed with which telehealth has been broadly adopted. And, a lot of the work that looks at, the engagement that it provides for people in a way that even in-person visits don't, because you are seeing somebody in their home, maybe their kids or the dog running around sideways or whatever. I think that makes it very appealing. And the fact that, if you calculate how much time it takes you to get to the doctor, wait, get checked in, wait, be seen by the doctor for 10 minutes, you can be looking at a 3-hour time span. So I think it's given people pause to say, technology really can work. And I myself have been the recipient of telehealth during this COVID pandemic and have found it to be totally amazing. And Chris is absolutely correct on the impact on no-show. But so it gives people, I think, a greater confidence. So some of the things that I think is, I think remote applications like in dermatology, like in other specialty areas where we don't have ready access to providers in Berkshire County, I think that there are applications, and there are now technologies that were quote unquote being tested that I think will also benefit from the kind of acceleration on the tech curve. I think that's one piece. I think the other piece, which does dovetail with telehealth, is the work that's being done in remote patient monitoring in the home. So what can we reliably do with in-home monitoring that can then feed into a telehealth session and potentially, for some people, obviate the need for them to come in. So I think some of those technologies that have historically been used in the home will now benefit from the ability to accelerate what it is that they're capable of measuring and reporting, and the application to be able to communicate with other systems. So I think that those are the key ones that I see, and I'm sure Chris has others, but that's what I would look for.
My response, while connected to telehealth, I think one of our challenges has been is not everybody living in Berkshire County has access to the internet. And they may not, particularly with the population that we serve, folks, just because of where they live, they don't have access, or maybe they can't afford it. And then do they have computers? Do they have phones? So that's been, I think, one of our challenges, is making sure that those that we're trying to reach out to have the tools that they need. I know, for instance, in my kids program, we made sure that the kids, that some of the families had a Chromebook, you know, and something, so again, so that we could continue to provide services. So as much as I am an advocate and am convinced that it will continue to be very much a part of our future, I think we need to ensure, if that's the case, which it looks like it's going to be, and not just for behavioral health. I mean, Leah's talking, if you will, physical health, you know, so it's really kind of both of them. So I think we need to ensure that people living in the community have broadband access, and get on a computer and connect with people. And if they can't do it that way, you know, then we're back, you know, can we do it via phone? And short term, right now, the state is reimbursing us for phone contact, but I don't believe that that's going to continue long term. So there's a lot of pieces that you need to take a look at.
Leah, did you have anything else to add about this issue of kind of accessibility? I was curious as well. Like, are you finding that everyone has access to what they need in these times, and or like how is that impacting CHP? Is Leah, did we get a little freeze here with Leah?
She looks a little frozen.
So we'll see if she pops back in, and until she does, someone did, Chris, ask a question specifically for you, so I'll go ahead and put that one in. They just wanted you to speak a bit about how the Breen Center is different from 18 Degrees.
Okay. So I think what I will try to do then is talk very briefly about the kind of services that we provide. 18, and I know that I believe that you've met with 18, or the group has maybe met or had opportunity to hear from 18 Degrees.
Yeah,
so I certainly won't repeat it by a long shot. But the one comment that I will make, and then let me answer the question. We're different in that we serve population from a very young age to adolescents.
So there's a real life example. I'm sitting in Great Barrington in this big building with internet connectivity, and you all just froze in an instant.
Yeah.
So what I was saying is that I don't know whether we just naturally defaulted to telephone, and so I didn't really hear about, oh, we couldn't see all these patients because they didn't have access to the internet. So I don't really know. But I do understand that's a problem. I mean, completely. And I just had one myself. So.
Right. Well, thanks for coming back on.
Yeah, me too. I'm glad.
Chris is currently answering a question that was just specific to her. A person in the audience wanted to know how Breen Center is different than 18 degrees. And so she was just going to say a few.
Oh, okay. Yep.
Yeah, so anyways, we provide services to young children, adolescents, youth, young adults, right through middle-aged adults and a more mature adult, if you will. 18 degrees focuses very much on kids and families, and we do too in our child and adolescent division, but 18 degrees provides a lot of preventive kind of services, and whereas at the Breen Center, we provide we provide prevention, but a large part of our program is actual treatment. So people come in for therapy, or we do telehealth for therapy, be it individual work, group work, or family work. So from my perspective, I think theirs is a bit more preventive, and ours is geared more towards those that are actually kind of living with mental illness or addiction. I'm not sure if that answers the question. If it doesn't, please ask it again. And I think my point, we provide services across the age spectrum. And we provide services that start with outpatient counseling right through residential treatment. We provide a full continuum of services. The other thing I just would mention is that while we differ from 18 degrees, we work closely with 18 degrees. They have a program that's known as the Family Resource Center. They subcontract with the Breen Center to provide behavioral health services, to provide the therapy services. We as an organization, and I don't want to speak for Leah, but we as an organization collaborate a lot with other organizations in the community, because I think we all know we're real good at what we do, but we can't do it all alone. So I think amongst us, there's a real strong collaboration, and I think that's one of the assets from my perspective that Berkshire County, that occurs in Berkshire County. So.
Yeah, I agree completely, Chris. And I think, you stick to what is your core excellence and then look at where there are other resources and figure out how you can make a partnership work. And sometimes the partnership is, nothing more than a referral agreement that this is the group that you're going to refer to. But sometimes a partnership means that you have kind of a financial investment with another party to see whether or not you can deliver a broader set of services. So I think it's key, and I do agree. I think it happens a lot more here. I'm not from here, but what I see here is the strength of those collaborations and the interest in collaborating. But one of the things, I'll just say this, one of the things that I was always curious about is if we really believe in the importance of collaboration and kind of working together, then why do we have so many nonprofits? Why don't they all look at their individual business model and figure out where it is that they can collaborate and merge with others? So then there won't be so many people going after the same pot of people for money.
It's a great question. I mean, that's one of the reasons the Nonprofit Center of the Berkshires exists, is to try to facilitate collaboration between these organizations and allow a forum to raise the question of, is there more efficiency that can happen in this entire infrastructure?
Mm-hmm. Mm-hmm. Yeah.
So I'm going to encourage people who are listening, if you have any questions, to go ahead and write those in. I'm going to ask one more question while I'm waiting for others to come in. I want to make sure we talk about how people who are listening can get involved. Now, obviously, you're both in professional healthcare fields, so there's certain things that volunteers can't do, but I'm assuming there might also be ways that people could get involved either with their time or with their support or with their dollars. And I was hoping that each of you could speak a bit about that.
Yeah, I mean, I think, for me, it's a couple of things. Interestingly enough, despite how large we are as an organization, a lot of people don't know a lot about community health programs. And if they do, they remember us as children's health programs, which, we're now celebrating 45 years. So we've been around for a very long time. So, we like to call it friend raising. We like to have an opportunity to spread the word about the good work that we're doing, and have folks then tell to folks, and so on, so that people can understand who we are and what we do. And also because folks may have ideas for things that we can do when they learn about our business. There may be opportunities for a tweak to a service line, or adding something into family services. I think that's key. We do have on our website, which I put there, we do have a web page called How You Can Help. And it kind of walks you through the food donations and other clothing donations, and obviously monitoring donations. And we do have a chief development officer who, I'm sorry, I just got a chat. A chief development officer, Betsy Strickler, who anybody can reach out to at any time. And I know, Erika, you can make sure that they have her contact information.
Definitely.
So we're just about, right now, we've been doing these Zoom chats with people that have either been donors in the past, or current donors, or just thinking about it, to get the word out. So that's it.
So donors are welcome, and donations of goods, of food, it sounds like clothing, and visit the online website to find out more ways you can. Great.
Exactly.
And Chris, would you like to share how people can get involved in helping your organization?
Sure. One thing that I do want to mention for sure is that I think our goal is to help those that we're serving to live really full and productive lives. And I think that that's one of the most compelling aspects of our organization. People may not be aware of this, but mental illness and addiction are among the most stigmatized diseases in the world. Thus, more time than not, individuals and/or families often suffer in silence because they're afraid to talk about it. So I would ask folks to consider kind of joining our campaign to end the stigma that is connected surrounding behavioral health issues in general, for sure. And how do you do that is, I think you provide moral support for someone that you may know that is seeking help. You know, congratulate folks, or you kind of reinforce somebody's efforts if they're participating in treatment. Speak up when it's necessary. I think, you know, the example that I use is, you know, I'll get all my dates wrong now, but it'll date me too. Anyways, you know, back in the 60s, nobody talked about cancer. It was the big C, nobody talked about it. Then in the 80s, we had the AIDS and nobody talked about that. But look at how far we have, there was so much stigma around it, is my point. And look at how far we've come. You know, and mental illness and addiction are diseases, just like diabetes, they are diseases. And so I think if you can just have conversations about it, you know, it's easy to talk about what you had for dinner or something you saw on TV or what your neighbor's doing. But if you could talk more just very informally and comfortably about it, it'll do a lot to get rid of, you know, to help us kind of break the stigma. So that's one way. I think the other way is if you have an interest in the work that we do or want to learn more about us, consider joining our board of directors. I'm at a point right now where I want to increase our number of board members. So I'm always open to having conversations with folks to see if they, you know, might work and be a good fit. And then of course, you know, always consider making a donation to support our programs and services, for sure. So. Wonderful.
There's one specific question, Chris, for you. At the very beginning you quoted a number. I believe you said 10,000 visitors last year that you utilized your services. The person, Louise, just wanted to know, is that unique visitors, or is that like distinct individuals, or total numbers of visits?
Unique.
Wow.
Yep. It's a good question, and it's unique.
So this next question is getting into kind of the landscape of our community, and I think both of you can answer it. So the question from Bob says, the level of substance abuse in the Berkshires, to my understanding, is relatively high compared to norms. What are the key things we need to address in our community, and how can this group help beyond what has just been mentioned now?
Well, that's and I will definitely only say a few things and defer to Chris. But I will tell you that, in fact, the rates are incredibly high. And, you know, Chris, along with CHP and BHS, are in an accountable care organization, 2 accountable care organizations. And in fact, what is driving everything is behavioral health, SUD, substance abuse. And so, you know, part of what folks are looking at is how, you know, what are all the pieces that are happening in someone's life that create this issue, and then how can you take, you know, something that we've been working on, which is on a pause now because of COVID, is the Second Street Community Center for people who are, you know, recently out of jail and have, you know, mental health and substance abuse problems. So it's almost like, what are all the different touch points in someone's life that occur, and how can you influence them and get them on a path where they can get clean and stay clean and be productive, and continue to have the kind of support that they need in their lives. But I defer to Chris, who's really the expert in this.
Some days, not all the time. I admit that, some days. So I think, you know, when you take a look at Berkshire County, you know, the reality of it is, if you take a look at our numbers, if you will, that there certainly has been an increase in drug use, but I just want to comment that alcohol-related disorders are still very high on our list as well too. And Berkshire County is just generally, you know, a more mature population. I'll just, you know, it's people, you know, if you kind of take a look at our population compared to other parts of the Commonwealth, we tend to have a bit of an older population. And I can say that because I am too, so I'm safe with that. But I just, you know, I think, so there's, you know, and they have, or not, oftentimes with an older population, they might have more needs, both medical and you know, maybe other behavioral health kind of related issues. It's maybe part of the aging process for them. So I think that's a piece of it, but I also think it's the economics of the community, for sure. It's the economics, the poverty, the level of homelessness, lack of jobs, lack of housing. It's any combination of. So to what Leah was speaking about is, you know, what we need as a county to get better at is treating kind of the whole person. We can take care of the behavioral health issues, but you know, what about housing? What about food for their family? So and I think we kind of, Breen and CHP and BHS are working hard to try to be more effective in that effort. The other reality is, and I'm not sure how the group can help, but I'll put it out there, is access to services. Now I'm going to speak specifically to the Breen Center. I'd like to say that somebody can call the Breen Center and they can get help like that. There are some cases when that absolutely does happen, but we oftentimes are working with a waiting list because I don't have enough licensed clinicians. And so how can you help is in conversations and discussions, you can urge people, you know, the younger or people that might want to come into Berkshire County and come into healthcare to kind of consider that. But that's one of my primary challenges at this point right now, is we just don't have enough licensed clinicians, which means that translates to us to a wait list. And it's particularly difficult in my child and adolescent program, because working with kids and families is a real specialty. And some folks are, some of my staff more easily are up for it and are skilled at it than are others. But licensed clinicians is the biggest issue for me. The other thing that I would say is, how can you help, is to advocate with local legislators. And will be specific to us, but I'm sure Leah has her piece as well too. Our rate of reimbursement has not changed in 10 years. So my money comes from the state. It comes from Mass Health, which is Medicaid. It comes from Medicare or state contracts. And if you take a look at the total picture, my rates have not been increased in 10 years. So I'm providing a quality service and still getting reimbursed at rates that were established 10 years ago. And when you talk about parity, I have psychiatrists on staff. They can see somebody and they get one reimbursement rate. If that psychiatrist is in the hospital, sees the same person, has the same conversation, the hospital gets a higher rate of pay. It's called parity. There is a suggestion, you know, so there clearly in today's world, the parity does not exist between reimbursement rates for behavioral health services and physical health services, at least in my world. So any advocating that you can do with local legislators, state legislators, even at a federal level, it's something, we've got to take a look at this, because we're in a crisis. You know, behavioral health needs are increasing, and fewer people are going into that field because I can't pay them. I can't really recruit them. It's one of my biggest challenges. So I'm sorry.
Leah, do you want to add into just things like that, advocacy pieces or community related things that this group can do to help the bigger picture?
Well, I think it's really important. People often are afraid to ask for help, and they're afraid to ask for help because, or they just don't know where to go. And I think my great advocacy piece is to try to find ways to have people understand all the resources, not just CHP, but others that are out there in the community. And one of the things that I'm working with, have been working with a group for some time called the Rural Health Network. And one of the things that has been a real acute focus for us right now is what in fact are absolutely all of the resources, and pulling together the 25 or 30 organizations that have component parts and have them know what's going on and have them communicating on a weekly basis so that we can keep people shored up. So I think advocacy in that regard. As a federally qualified health center, we are supported in part by the federal government. Of our $25 million, we have a federal grant for, I'm going to say about $4 million. And that grant entitles us to a steady reimbursement, although, you know, it's never enough, as Chris will tell you. And also support for malpractice insurance. So should anything happen, the federal government supports you. The difficulty is that, and we have only a small amount compared to the other 42 health centers in the state of Massachusetts. We have a small amount of federal money. That designation also, I forgot to say earlier, means that we take everybody and anybody regardless of ability to pay. So it doesn't matter if you're illegal, it doesn't matter if you have no insurance, you know, we take all comers. So that's why the federal government gives us money. If you took that out of the equation though, we would be underwater. We wouldn't be able to survive. And the federal government, and I'll try not to get political, but under somebody that we all know, is not interested in continuing to support federally qualified health centers. So, you know, we have really run the risk and have pleaded actually to be sure that we can get the monies that we need. We were fortunate that through the Health Resource Services Administration, we got funding to help support us while COVID has been going on. It's never enough, but at least it's something so that we didn't have to lay anybody off, which was a really good thing. So I think, to Chris's point, advocacy at the federal level, when we do state, local, and federal level advocacy to provide funding for community health centers is really key. It's really key.
Excellent. So this question will go to both of you as well. Is there, just speaking more about who can access your services, is there a max annual income for people to be eligible for the services that either of you provide?
No. There's none. You're just come in the door. Doesn't matter how much money you have. Yeah.
Same here.
Yeah.
Great.
Yep.
And another question, this one is specifically also about the populations. It was directed at Chris, but Leah, you might have something to add as well. Do you see large numbers of people, especially from older populations, with addiction to prescription drugs?
Yes. Yes, we have. Yes, we have. So, and I think that our medical director, Jenny Michaels, I'm sure some of you have heard of her. She's an addiction specialist, and that's one of the areas certainly that she specializes in, and has been actively involved in the larger community around prescription drugs and making changes and actually recommending and being part of the changes that have been made around prescribing drugs, drugs for folks. Yeah.
And Leah, I don't know if you have anything you'd like to add on that.
I would assume that the same is true because we probably in fact do see some of the same people. So yeah. I would expect that we have a similar, population.
Excellent. So I think somebody said something earlier, I think it might have been Chris, about speaking about the community at large and some of the challenges. And I find it sometimes surprising, especially if you're not from here, to think about the amount of homelessness or poverty or hunger or joblessness. And I feel like one of our roles here in coming together is to just continue to create the landscape, like to create an accurate impression of the landscape of the Berkshires. So I just wanted to hear from the perspective of each of you a bit more about the community that exists here in the Berkshires. What are you seeing? What is, how does it look from your perspective, the people who are here?
Well, it's, there is a lot of poverty, and especially down here in South County, there's an incredible disparity between many of the people who are here and are second homeowners or second homeowners who became primary residents and the rest of it. One of the story that I always think of when I think about what poverty is here, two stories. One is that Dr. Whitfield, who started Children's Health Program, used to drive with his nurse through the countryside looking for diapers on the line to find children in those families who had never had any kind of medical care and whose parents were suspicious of doctors. One of the things that is really nice about the mobile health unit is it goes into the hill towns and brings health care to people who don't want to come down and don't want to go into a bricks and mortar building. And there was a time that Michelle Durr, who's our family services director, said they went up into the hill towns and they saw a man who basically had sewn his own leg up. He had cut it with a saw and sewed it up because he didn't want to go see somebody. they were up there and they took care of him. So I think that there's incredible, we see that the homelessness, we have a neighbor to neighbor program that we have in place. We put up homeless people in the motels down the avenue here from the Great Barrington office. We put together a COVID isolation and recovery unit for the state for homeless individuals that tested COVID positive, and we ran that out of Pittsfield. It really can be heartbreaking. And Chris, I know you've been here a lot longer than I have, but
Yeah, I would just say I think that it's very much a part of Berkshire County, but I think what can happen is that oftentimes people don't want to talk about it. So I guess it's a social worker in me, that I think that the more people kind of talk about it and become aware of it, the more that people can get involved in planning around how to support what's going on in the community around the poverty, the joblessness, homelessness. I know that there is a organization or a group that Lee and I both participate in, which I think these days is called the Berkshire Leadership Group, or something along the lines of that. Mm-hmm. And I know that as a group of leaders in the community, while that's a piece of what we talk about kind of what is happening in the community and what can we as a community do kind of collectively around that. Because I think, the goal, well, from my perspective, I think is, making Berkshire County a better place for everybody that chooses to live in Berkshire County. So I think that there are groups and or organizations, and I think the better we get and the harder we get at collaboration around that, I think ultimately the better off that we'll be. And I think the other piece is we shouldn't always be the ones doing that planning. You've got to talk with the people that are living in poverty, that can't get food, that are homeless, and make them part of the planning process as well too, because they know best what kind of support and what's going to get them to a better place if that's what they want. So, yeah.
Yeah, I think it's an important conversation. I would encourage, those of you who are listening in on this and are going to be sitting with other leaders of other organizations to continue to bring this topic up, because every leader, I believe, has a different lens on it because of where you're sitting and who you're serving. And I think the more people talk about it, the more we'll actually get this accurate experience with the community that we're all living in. So there's a question here that I'm not sure if either of you can answer, but I'll put it out here. It's specifically about the Berkshire Taconic Community Foundation. The question says that the Berkshire Taconic Community Foundation was mentioned. Can you say more about that organization? It seems to provide broad support in a number of different areas.
Well, we've actually received money from the Berkshire Taconic Community Foundation, and I think they have, as best I can understand how they're organized, is that they have a bunch of individuals who in essence are invested in the foundation, and each and every one or groups of them have specific areas that they like to see their money designated to. And so that when something happens, and something like COVID or other things that you're interested in, let's say grant money from, you basically apply to them and make your case, and then they bring it back to the people who are providing the funding, and then they'll come back to you and let you know if you've gotten it. But we did get some COVID funding from them. Yeah.
And as did we. We, from a bit of a historic perspective, have not gotten, not in my recollection anyways, we haven't received any funding, nor have we pursued it. So, but most recently around COVID, they certainly did, as an organization, step it up in conjunction with Berkshire United Way, and made sure that community needs were getting met. So we did get funding from them.
And I might make a request to Ray to tell Megan, perhaps having a representative from the Berkshire Taconic Community Foundation as a part of this speaker series might be helpful if that's of interest to the
Right.
And this looks like a specific question for Leah. Can you just clarify, Leah, the places that you're able to go with donations? Like where are your donation centers located? Not specific address, but like even which towns you accept donations?
Great Barrington is the central clearinghouse, although anybody at any time can go to one of our locations, one of our 10 locations, which are on our website. And so if you're in Pittsfield, walk in the door to Neighborhood Health and Dental Center and say, I have a donation that I want to make for CHP, and they'll take it right there for you. If you're interested in kind of seeing where all of that family services happens, then coming down to Great Barrington to 442 Stockbridge Road, you'll kind of get a real full sense of it and probably have an opportunity to talk to somebody who works in the program.
That's in Great Barrington.
Yeah.
Excellent. So well, we still have a little bit of time for additional questions that might be out there from the room. I will ask another question while we're seeing if any others come in the chat. Is there something, just switching gears a little bit, tell us something that we might not know about your organization that you'd like to share with us?
I'll jump on that one. Most people don't know that the Breen Center has been serving the community for 100 years. Had COVID not gotten in our way, we would have had a series of events from North County down to South County to celebrate our 100 years this year. So next year, we're going to celebrate 101. But actually, the first clinic in Pittsfield that was opened by Dr. Austin Riggs at the House of Mercy Hospital, which is BMC today, and that was started in 1920. And the Breen Center's history has been, that's how the Breen Center started. So I will share that. I have another interesting fact, but I'll let Leah jump right in.
This is an interesting factoid. There actually are COVID babies. And we've delivered COVID babies. There are our Women's Health Service, which is obstetrics and gynecology here in South County, and we work collaboratively with Fairview Hospital, which is where all of our babies are delivered. The number of estimated births has gone up. I can't even remember what the number is, but I was actually surprised to learn that there was actually COVID babies, you know, which requires some special considerations, I think. But we're, you know, I'm just really thrilled. I mean, we've got, as Chris said, we have an amazing staff, and, you know, maybe some of you know someone that works for our organization, but these people are amazingly dedicated and devoted, and, you know, they live the mission of basically improving the health of the Berkshires. That's basically what we do every day. So that's sort of one piece. And the other thing, which is sort of my further plug for help, is that our family services business, department, service line, whatever you want to call it, is exclusively supported by grants and donations. So it's not as if there's no reimbursable visits or anything like that. So we are proud of the work that they do in terms of wraparound services to health and dental and the other clinical specialties. But they are wholly dependent on grants and donations. So.
Excellent. There haven't been any new questions coming into the chat field, so I'll just make one more request for if anyone else who is listening has something they would like to ask, feel free to type it into the chat. You can also use the raise hand feature, and if you'd like to ask a question out loud, we could do that. I'll ask you a little bit of a forward-looking question, a crystal ball type of a question here. Obviously, you know, nobody has that ability accurately. However, if you could just look out 5 years from now, I'd be curious to hear what you could see, what your organization might look like in 5 years, and also tell us kind of like what would have had to happen for it to get there? Because obviously we could be going in multiple directions from here, but look out 5 years. Where would your where could you see where could you imagine your organization being in 5 years, and what would have needed to have happened in order for that to got there, to have gotten there?
So I'll start. Okay. Yeah. So I think the need for our services is going to increase over the next 5 years. I typically am a glass half full kind of person. So I am going to be optimistic and think that over the next 5 years, at federal level in particular and state level, the folks, legislators, the people that need to set our rates, the people that set the rates are going to recognize the increasing need for the services, and in order to sustain it, they're going to increase our rates so that we actually are getting a reimbursement rate for a service provided that is comparable to all of the work that we put into trying to provide that service.
I think for us, the real obviously the short-term focus for us is to reestablish our financial base and get back to a point where we can do many of the things that we want to be doing in terms of pay increases and employee engagement and training and education, and a lot of those things that internally will bolster the business to move forward. And then I think going forward, I see for our business, the patient is the hub, and there are a lot of spokes. And some of the spokes go to health and dental and nutrition. And, there's a lot of different touch points for a patient. And I see us as trying to fill that out. And I also see us as an organization that will grow in size, that we will expand because there are many more people out there who need services or in areas where there aren't any services. And I think it's our responsibility as an organization to be able to fill that need. So I see our service line getting more robust, and I see our geography getting more robust.
Excellent, thank you for letting me put you on the spot with that question. So there hasn't been anything new in the chat field. There was a request to make sure that email addresses and websites get to the participants, and I know that the Ollie team has agreed to do that. So you'll be able to get the email address and the website for our 2 guest speakers for today, so that you can follow up and learn more. Maybe we'll just turn it back over to each of you one more time with just any closing thoughts, any closing messages, takeaways, what you hope people will walk away remembering from this conversation with each of you.
Well, I guess I would say these are just such amazing times that we're under. It's incredible. I don't think in my lifetime I ever expected to be, and I'm in the senior set with Chris, I ever expected to see what's going on from a health standpoint, from an economic standpoint, from a political standpoint. And I think it's most important for us as an organization, and I think to reinforce in the community, that we never lose sight of what our primary purpose is, which is to take care of other people. We're in a helping profession, and it's easy to get sidelined or sidetracked or get so internally focused that you say, well, I'm not going to deal with Chris because I can't deal with all that problem. I'll just take care of myself. So we need to band together, and we need to remember that's our primary purpose, is to take care of others.
Wonderful, thank you. Chris.
So I'm just gonna, 2 things. I'm gonna throw out just one other little kind of tidbit of information so that people are aware that we have our crisis clinicians that co-respond with the police departments, not both, in North Adams, in Pittsfield, and down south in Great Barrington. And that's been an incredibly well received by local police departments and well received by the community, because oftentimes we can intervene much before a person ends up in the hospital. And we can diffuse a situation or get things kind of set up so the person doesn't have to go into the hospital. So I think that's one more tidbit of information about the Breen Center that I wanted to share. The other is to say, again, thank you for this opportunity.
Yes.
I am here, I am available. If you want to have a follow-up conversation just to learn more about the Breen Center, I'm certainly very, very open to that. And we, as Leah just said, we remain very committed to treating, meeting the needs of the emotional needs. I'm going to go back to kind of where I started, the emotional needs of the folks in Berkshire County. That's our primary focus, and will remain our primary focus. And anything that anyone can do to help us kind of fight the stigma connected to all of that, so people are more willing to kind of come in and get services, that would be incredibly appreciated from our perspective. Because back to that 5-year thing, I would like to see in 5 years that there is no more stigma attached to mental illness and addiction, that it's treated as any other disease. So, thank you.
And yes, in the Berkshires especially, we can be the community that can make this happen. We could actually be leaders in the nation as a place that really steps up and embraces this and takes care of it.
That's right.
So everyone who's been watching today, you are now ambassadors. You're ambassadors of the Breen Center. You're ambassadors of CHP. So please spread the word. The Berkshires is such a word of mouth community. That's really the #1 way that information spreads in the Berkshires, is word of mouth. So please spread the word about what you heard today. Talk about the Breen Center, talk about CHP with your friends. If people are asking where they can get services or help, you now know the executive directors and presidents and CEOs of some pretty amazing places. And please share that with the community. So Chris and Leah, thank you so much for sharing your time.
Thank you very much. This was a pleasure.
It was fun. Thank you.
Yeah.
And to all of our Ollie friends, thank you for having us all. We hope that this answered many of your questions about this sector of our economy. And if you have any additional questions, please find any of us and ask, and we'd love to come back anytime.
Thank you. Take care.
Thanks.
Bye-bye.
Thank you all.
Bye.